Hi, this is Rachel Krentzman from Embody Physical Therapy and Yoga, and I'm here to teach you my top 3 yoga poses for sacroiliac joint dysfunction. The sacroiliac joint is a complicated joint, and it's just below the low back, and often we think we have lower back pain or a disc problem, and sometimes it's actually the sacroiliac joint. This happens a lot in yoga practitioners and teachers because we do a lot of movements like twisting, deep back bends, deep forward bends, and can be aggravated sometimes by a flow style of yoga. So my favorite poses entail a lot of stability training and strengthening. The first pose is Tadasana, mountain pose, and you just need a block. We're going to come into a standing position, take the block between the legs, have the toes pointing straight ahead, okay, and squeeze the block. So as we squeeze the block, we're also rolling the thighs back, rolling the inner thighs back. So there's a slight internal rotation. Reach down through the fingertips. And then there's a gentle lift in the lower belly on every exhalation. So as you roll the thighs in, lift the lower belly and feel the tailbone descending towards the ground. Keep the chest open, shoulder blades moving away from the ears, and a lift through the crown of the head. Keep pressing all 4 corners of the feet into the ground, squeezing the block, rolling the thighs in, and lifting the belly. So you want to hold here for about 30 seconds to a minute. And I do recommend practicing this many times throughout the day and repeating it at least 2 or 3 times each morning or each evening. The next pose is a wall sit. So we're going to sit against the wall and place the block between the knees. So we never want the hips to go below the knees, and you want to make sure the knees are right above the ankles. Then you press your back, your spine into the wall, so everything has contact with the wall, and sit. Then we focus on squeezing in. So the emphasis is really that abduction. Good. And the legs will be burning, that's okay. Enjoy it. We hold here for about 30 seconds if possible, and building up maybe to 1 minute. And again, this can be done many times throughout the day, just to focus on strength and stability. Okay, then we come up slowly, pressing the back into the wall. And the third pose that I recommend is a bridge pose. The Sanskrit name is Setu Bandha Sarvangasana, but we're going to do it with the block between the legs, and that will create more stability and strengthening and integrity in the pose. So lie on your back, place the block between the legs. You want to make sure the knees are hips distance and the feet are pointing straight ahead. Press the hands into the ground, squeeze the knees together, and lift the hips up. Hold here, about 5 or 6 deep breaths, emphasizing that abduction or squeezing in of the thighs, and then lower down slowly 1 vertebrae at a time. Because this is a strengthening pose, we want to do this a few more times, so we'll lift up again, and squeeze the block as you lift up. In addition to squeezing the block, we also want to think about the inner thighs moving down towards the floor, so an internal rotation in the thighs. And come down slowly, and release. So those are my favorite 3 postures that I often give my patients who come in with sacroiliac joint problems. I also tend to adjust their yoga practice so that they focus more on their stability in their postures and avoid doing a lot of movements that go from forward bending to backward bending, like downward dog to upward facing dog many times. So I highly recommend that you work with a skilled yoga teacher and physical therapist to adjust or normalize the torsion in the sacroiliac joint, and that this practice helps build strength and stability for you. My name is Rachel Krentzman, and my website is embodyphysicaltherapy.com, E-M-B-O-D-Y, physicaltherapy.com. Thank you so much.